Welcome to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza Salon and Spa and Hair and Scalp Wellness. So excited to be here today. We have a very special guest. We're here with Dr. Laurie Benzie, and she is a general surgeon and also specializes in gastrointestinal surgery. And she's a very wonderful, learned woman who works right here in our JFK community. So I'm so excited to introduce you all to Dr. Benzie. Hi, Dr. Benzie. Thank you for coming.
Hi, Ann. Thank you, and thank you so much for inviting me and having me on this beautiful day.
Yes, it's great. This is a wonderful show for our home viewers, just to get an idea about what you do for our community and what you do over at JFK. So tell us a little bit about your board certification.
Sure. So I'm a board certified general surgeon, which means I did 5 years of residency training in general surgery. After that, I did an additional training for 1 year in complex gastrointestinal surgery at Methodist Richardson in Dallas, Texas. Wow. But I'm originally from Long Island, so you know East Coast girls must come back. So never thought I would live in New Jersey, but I actually love it because it's a less crowded version of home.
Excellent. Oh, that's great. So you're right pretty much in the JFK area most of the time, correct?
Exactly. So JFK University Medical Center is my main hospital. I also have privileges at Raritan Bay, both Perth and Amboy, and I do elective surgery at Woodbridge Medical Center as well.
Wonderful. So that's all here. That's our stomping grounds right here in this community. And when you do general surgery, before we get into your specialization, what types of general surgeries come up for you most of the time?
So my bread and butter are really gallbladders, hernias, and anyone that comes through the emergency room with any kind of acute problem. Usually that's appendicitis or inflammation of the appendix. It can also be bowel surgery or just regular lumps and bumps. I like to say I do pimple popping on some days in my office too. So I do anything from very small skin lesions to major, large abdominal operations.
Wow. And I know that you do robotics as well, so I'm really excited to talk about how you go ahead and do that, because that's a real specialty.
I love it. About 95% of my practice is robotics, and I actually originally wanted to do plastic surgery. So for me to be able to do a giant operation through little incisions, and my patients do very well after, I think is really combining the best of two worlds.
So the robotic surgery, just to elaborate on that, is less of a recuperation for a client.
Exactly. So it's much less invasive. The incisions are much smaller, which means that the recovery time is much quicker. A lot of people are very concerned about the size and cosmesis of their incisions as well. So I always tell them I will make them as beautiful as humanly possible, and I have special tips and tricks for patients after who still want to have their swimsuit season go on and have beautiful scars. It's like they never even happened to them.
Well, that's wonderful, especially for us women. I know my brother had a real big incision from an appendix burst, and it was, a surprise surgery, and sometimes it does happen that way. So I guess you have to be able to be ready for both.
Of course, you always have to do the safest thing for your patient, regardless of the way that you do it. This is what I always tell people: if I can make it as beautiful as possible, even with a larger incision, I will. But obviously their life is more important than the size of their scar.
Absolutely, absolutely. So talk to me a little bit about this gastrointestinal certification and how you go about that and who you see for those things.
Sure. So primarily, those are patients that have been experiencing reflux, have been on medical therapy, may have had endoscopies over 5, 10, 20 years, and their symptoms are really not getting much better, or they need to get off of their medication for whatever reason. So a lot of those medications are actually only designed for 8 weeks of use. Most of the patients that I see have been on them for at least a year, 5 years, some patients 30 years. And they've never had, any resolution of their symptoms as well. So primarily, those are the people that get referred to me by their gastroenterologists. But I've also had a lot of community outreach recently, and patients have realized that they're not really supposed to be on those medications, and then they're able to call my office and get a comprehensive workup all in one place.
So would you say that surgery is the only thing that can get them off of those meds, or can diet and sometimes preventative medicine in any way help?
So it's a full package, right? You start from the bottom and work to the top. Surgery, obviously, I am a surgeon. I love to operate, but I don't want to operate on anyone that would be worse than they are after meeting me than they were before, right?
Sure.
So when I see these patients, I put them through a pretty rigorous preoperative workup. I also counsel them on diet, nutrition, exercise, foods to avoid, don't eat before bed, about elevating their head of the bed as well, and a lot of different like behavioral strategies that can help their reflux as well. The challenge with reflux is that it's not only a physical issue, it's a mechanical issue. It's basically like plumbing, right? So if you don't fix the mechanical issue, then it's never going to get 100% better. But there are ways, of course, to live with those symptoms.
So again, I just wanted to find out what some of these upper GI illnesses are called so that the viewers at home can understand what types of illnesses you might be treating.
Of course. So when we refer to reflux, what we actually mean is gastroesophageal reflux disease, or GERD. The other thing that people refer to it as is heartburn or agita. All of those are the same, right?
Okay.
And mostly what that means is that the contents of the stomach are refluxing up into the esophagus, which is the food tube. And there's two reasons why. One is because there's some sort of structural or mechanical plumbing issue, like a patient has a hiatal hernia or another form of surgery in the past. And then the second part is because the muscle at the end of the esophagus that's supposed to be like a one-way valve is open too much, and it allows those contents back into the esophagus. So therefore, that all that acid that the stomach makes to help us digest our food is actually refluxing back up, and that's why that burning sensation happens, and people call it heartburn.
So that can happen on occasion, and you might not have an extensive upper GI issue, or if it's constant, that's when we're talking the plumbing may need to be reevaluated.
Absolutely, absolutely. So it's normal to have a little bit of reflux if you were to go around the corner and get a slice of pizza with some really good marinara sauce on it. Totally normal, happens a lot here in New Jersey, right? But if you're someone that wakes up in the morning and you have that constant sensation of reflux, if it wakes you up at night, you have a chronic cough, like a hoarse voice, you're losing weight because of it because you can't eat, those are all warning signs that you need to seek medical attention.
Wonderful. Yeah, that's very important. You know, being that this is a wellness show, I love to give our home viewers an idea of what they might be looking for and when they would need to seek medical attention. So very, very important.
Absolutely. So especially patients that have seen a gastroenterologist before, maybe getting regular endoscopies, may have been on medication for this. It's not really helping in the way that it should. Eventually, if you have chronic reflux over 10, 20 years, you can actually get changes in your esophagus, something called Barrett's esophagus, where because those cells have been washed over by acid when they're not supposed to, the biology of them, the DNA within the cells actually changes. And unfortunately, what that means is that those changes can progress to esophageal cancer, which is not something I would want anyone to ever have.
No, absolutely. So how much would you say this upper GI is attached to the lower? I know that the lower isn't what we're discussing today, but how much of that is connected?
So there's always a mind-gut connection is what we call it, right? So the neurons in your brain are separate from those in your gut, but they do interact in many very cool ways. The body is amazing in the way that it's actually regulated. And the challenge when you have an upper GI issue is usually the food choices that you make also affect your lower GI issues, right? In general, when people come to my office, they're all suffering from chronic constipation. I could go on for half an hour talking to you about all the issues that go on with constipation as well. It's a very serious medical condition that's actually very underdiagnosed and undertreated. And the challenge which a lot of my reflux patients have is that they don't drink enough water, they don't hydrate enough. So despite thinking that they're going regularly, whatever that means for each individual person, they actually have severe constipation because the medication, the fiber intake that they're supposed to be getting is really not helping them because they're unable to stay hydrated adequately.
Very, very, very interesting. I think a lot of people suffer from that. We're constantly hearing, all of those disorders. So that is something that, what would you say a home viewer could do if they were constipated? What do you recommend?
Oh, I can go on, like I said. So it really comes down to three things. So number one is hydration, right? So make sure that you're drinking adequate fluid throughout the day. That doesn't only mean water. It can also be Gatorade, Powerade, something with some electrolytes in it as well. Obviously, if you're diabetic, you need to get the sugar-free version of that and not add any additional sugar into your diet. And in fact, the sugar-free version of most of those actually acts as a laxative as well. So sometimes that can help. In addition to that, fiber intake is a big challenge. So eating 3 salads a day, probably not something that's feasible for most people. But my recommendation is usually if you're going to have like a morning smoothie with yogurt, put some spinach or kale into it. And that can really be a way to get that fiber intake. If not, there are different supplements. There's actually gummy vitamins now that you can take that have fiber in them. And if that fails, there's always the big guns, which is actually taking over-the-counter medication. There are a lot of different types for this. It wouldn't be something that I would recommend for people to use every single day, but you shouldn't obviously be in discomfort or be on the toilet for the majority of your day. That's not good. I always tell my patients if you need to be on it for more than 5 minutes, you need to get up, try again later, because you don't need to be spending your entire life there. And there are also natural supplements as well, different kinds of teas, herbal supplements that you can get just at the regular grocery store or at health food stores as well. But caution with that, you always want to read the back of the label and make sure that they have some sort of comprehensive quality program for the products that you're buying, because there can be a lot of additives in those supplements that actually can interact with your regular medications as well.
Wonderful. This is very informative. I love it. So tell me about your center and your office and the types of services that you provide right there on that JFK campus.
Perfect. So when I started at JFK about 2 years ago, we did not have any capability of doing on-site reflux testing or motility testing for our patients. The benefit of having everything in a one-stop shop, which is really what I work to create along with the rest of the team that I have at the Reflux program, is something that's easy, efficient, and gets patient the correct diagnosis for their problem, which I think is really half the battle. So as part of the program, obviously you can be self-referred or you can come from your gastroenterologist. What I actually do is see patients in the office first, get a greater picture of what the symptoms are that they have. So some patients have reflux, which means the content's coming up, they're having heartburn. Some people have dysphagia, which is actually trouble swallowing. So people that can't eat steak, bread, certain pills, large medications, they get stuck on the way down. That's a whole separate issue that is usually misdiagnosed as having reflux disease. So once I kind of get to the bottom of their symptoms, then comes the testing, right? Usually endoscopy, which is a small camera that goes through the mouth, looks into the stomach to see if there's any kind of mechanical issues, is the first step. I also do different x-rays and imaging to make sure what I'm suspecting or seeing is actually there. Because if it's a plumbing issue, I need to know the route of the plumbing, right, before I go in and try to fix it. And then the last step is if I'm suspecting that someone actually has a motility disorder, so the muscles of their esophagus are not moving food or other like pills down the way that they should, I actually have a special test that I do that can actually see in real time as patients swallow how they're able to pass food down into their stomach. So those three things together really give me a good idea of how I can help patients. And sometimes that means surgery, sometimes that means lifestyle modification, and sometimes that means additional endoscopy therapies as well.
And you do that all right there on site?
On site at JFK in my office and then in our endoscopy suite. And then if there is a patient that I do think that would benefit from an operation to help with the reflux, that surgery is right there too.
Do you do that at the hospital, the surgery, or do you have a surgery center?
At the hospital.
Okay.
At the hospital.
And what does a surgery like that look like? Recovery, you know, from the beginning to end, is it a day surgery? Just so the guests at home know.
Sure. So I do this robotically. So it's very small incisions. The largest is 8 millimeters in the abdomen. I actually go through the belly and work on everything from the level of the chest down. So the challenge in this kind of surgery is if someone has a large hiatal hernia, which means a portion of their stomach is actually trapped in their chest, I have to mechanically bring that back down first. So that's usually the first step of the operation. The second part is actually fixing that defect that the stomach was able to go through. That's called the hiatal hernia. Hiatus just is the hole that happens. Everyone has it. That's how we eat, how we get nutrition into our bellies, is through the hiatus. Sometimes it's a little bit larger than it needed to be. So then that has to get repaired. And then the third part is the valve that we were talking about before. It needs to be just right. So it's kind of like a Goldilocks situation is how I explain it to most of my patients. So I actually recreate that valve or reinforce that natural valve to prevent things from coming back up into the esophagus. So it's a 3-step procedure. Usually my patients stay at least 1 night in the hospital. The reason why is because I do not want them to throw up in any way, right? Because it's a lot going on in a very small location.
It's trying to heal.
And I'm trying to heal everything so it stays in the right location forever. The goal of this operation is to never have to take a single reflux medication ever again. And I actually get my patients off of their medications within 30 days of surgery.
Wow, that's excellent. So you go on in there, you do this, and then do they have immediate results?
So,
I mean, obviously the 30 days, but...
Almost immediately. There is a special diet that I do have them stay on for the first 4 to 6 weeks. It's usually easy to digest food because I don't want them to have any issues.
Yes.
And then it's the same lifestyle modifications I advise them in the beginning too. So limit your spicy food intake, nothing too heavy or greasy before bed. Drink water separately from your meals because that can be an issue as well. But in general, people, the next day I ask them, do you have any reflux last night? And they're like, no.
Wow.
And they don't realize that it's the first time in 5-10 years that they haven't woken up with that sensation. So it's pretty immediate.
That must feel really great as a physician to be able to help people that way.
Absolutely.
Because it's uncomfortable.
Yes.
I mean, there's so much we take for granted about our physical body and, like, you know, not having those types of symptoms. I mean, yes, it's bad when you have them occasionally, but to live with it, it must make you feel really, really good to be able to help people with that.
Absolutely. It's immediate gratification, which is always great, especially when it comes to doing an operation, because you can really change someone's life in a matter of hours, and then they go on and they don't even remember that they had surgery, which is great for me too, because patients, I like happy patients, and I like my patients to stay at home and see me in the grocery store and not in the hospital. So that's what I always tell them.
That's great. That is great. So tell us anything else you want us to know about all that you do right here in this community for our Woodbridge area and our Edison area, just so that our viewers at home know what they can come to you to seek help with.
Of course. So in addition to taking emergency room call and developing this reflux and motility program, I also do a lot of cancer surgery. So I mentioned esophageal cancer before. The challenge in our community is that we have great centers that are not too far away over a couple of bridges, right? So it's a long journey for patients to go back and forth out of our community and go to whatever center they choose. Obviously, there are some specialized things that I would always recommend that people go to someone that does that operation constantly, or someone that takes care of those patients every single day. But that is something that we are now capable of at JFK University Medical Center, of actually doing a full spectrum of cancer care. It's something that our program has really initiated over the last several years to months, and we're actually going to be developing a cancer center right on JFK's main campus that will also be very similar to the reflux program, like an all-in-one, one-stop shop for patients that have any kind of oncology need as well.
Yes. And I do believe a lot of these cancer centers are following the same protocols, and I think that it's comforting, dealing with cancer patients myself, that doctors do confer, and they do confer and then provide the same care that they would provide more locally, and if you can do that, then that's great. And I think that that's a convenience for people that are already burdened by this very inconvenient disease.
Absolutely. You know, I always tell people the first time I ever meet any patient that comes to my office for any kind of cancer diagnosis or suspected diagnosis, the first thing I do is I'm so sorry that you're going through this. And it's not only them, it's actually their family as well. So family is such a big support for all of my patients, but especially those that have cancer diagnoses. And I hate the idea of them going alone, right? And trying to interact with providers they haven't met before, because you always need a second and sometimes a third set of eyes and ears when you're dealing with things as serious as this. So I think the great thing is, you know, in staying local in our community is that you get the best of both worlds. So you're able to, you know, have portions of your treatment here, but also have the benefit of a larger tertiary academic center in Maine, Hackensack University Medical Center as well. So once we're able to get everything all on one page, and of course confer, as you mentioned, through tumor boards, through second opinion diagnosis with pathology, I think having that localized care be the best it can be. I mean, I would want a place that my family would get the best care, right? So that's really what we're striving for at JFK. And I think over the last couple of years, we've really made great developments in those respects as well.
Well, that sounds really like something we need. And you're so learned and, you know, proficient in what you do that I just think that it's a beautiful, beautiful thing to offer all of our local communities. So it's great to see that that's expanding here and that people have that option to stay local and still get treatment and, you know, feel comfortable with the physician that they're choosing to deal with. And I can't imagine anyone wouldn't feel comfortable with you, because this has just been such a great conversation and you just have such a beautiful manner and way to speak to your clients. So I'm sure that they are so comforted by you, which is important.
I treat everyone as if they're my family, and especially my cancer patients. I tell them that you're mine for life. So if you ever need anything, I should always be one of the first several phone calls, regardless of the situation. You know, and I wouldn't want anyone in my family treated any other way. And that's how I've approached everything in all my training and through my experience as well. I've learned that the greatest providers are those that, you know, have that approach. So I try to emulate my role models as much as possible.
Well, I think that that is just priceless. And I do the same when I'm dealing with my cancer patients, because that personalized care is everything to them. So it has been such an honor to meet you today and to talk about all that you do and all that you can provide. And I hope that our home viewers really take advantage of that, because we are so lucky to have you right here. So thank you for coming today to Wellness Woodbridge, and we're thrilled to have had Dr. Benzi here. We hope that we've answered a lot of your questions on upper GI issues, on some types of surgeries that she can offer in general surgery, and it's all right here at JFK and some of our surrounding hospitals right here near Woodbridge. So we're so happy to have you here with us on Wellness Woodbridge, and we look forward to seeing you again very, very soon. Have a great day.